We want to take you live now to the Ontario Legislature, where the first question period of this new session is underway. Let's listen in live to Marit Stiles.
Defend that bill. But Speaker, the workers won. And the courts have ruled once again that Bill 124 was unconstitutional. It was an unconstitutional attack on the rights of working people and their paychecks.
Question.
And so my question to the Premier is, will he apologize to Ontario's hardworking nurses, PSWs, teachers, educational assistants, and all the public sector workers for suppressing their wages with Bill 124?
Members will please take their seats. To respond, the Premier.
It's great to be back in the House here, and it's so nice to see everyone. You know, maybe I'll start with the cost of living that the Leader of the Opposition went around the province, she said, and looked at the cost of living. Well, let's tell your constituents and everyone in Ontario that you voted against the one fare that we put forward that saves people $1,600 a year. She voted against getting rid of the license sticker fee, again, voted against reducing the gas tax by 10.7 cents. She voted against getting rid of the tolls on the 412 and 418. So I don't think the Leader of the Opposition really cares about the people and making sure that they keep the costs down, taxes down, because she's voted constantly against us reducing the tax. Let's talk about health care. There's no government in the history of this country, not to mention the province, that is spending $81 billion a year. That's up over $20 billion since 2018.
Thank you. Thank you. The supplementary question. Back to the Leader of the Opposition.
Speaker, you know what we voted against? We voted against Bill 124. And we told this government it was unconstitutional. And I'll tell you, Premier, that did not sound like an apology to me, Speaker. The government not only used their power to cut the wages of healthcare and education workers during a pandemic, they spent untold amounts of dollars fighting those workers in court for years, only to be told what we already all knew. The bill is and always was unconstitutional, Speaker. So through you again to the Premier, do-over, how much did this government spend on legal costs to keep down workers' wages on Bill 124?
Members will please take their seats. Premier.
What we've done for the healthcare workers, which we think the world of. We think the world of the nurses. As the Leader of the Opposition voted against the $7,000 bonus that we gave the nurses, she must not have cared about the nurses. But the nurses, you know something? The nurses out there, we're paying for the education of new nurses, and obviously there's a huge take-up because we set another record of 17,500 nurses registered last year. We've seen over 80,000 nurses register in this province in the last 5 years. Over 10,400 doctors have registered. We've added more seats, 449 postgraduate seats, 260 undergraduate seats. We're building new medical universities that have been built in decades, Mr. Speaker. As the Liberals froze healthcare funding, we increased it $21 billion. As they slashed physician services and cut residency seats, we've added them. We've added over 3,500 beds. We're going to add another 3,000 beds.
Thank you. Thank you. The final supplementary.
Thank you, Speaker. Well, I guess we'll find out eventually one way or another how much it cost. But, Speaker, Bill 124 deteriorated conditions in hospitals, in long-term care facilities at the worst possible time. We were already struggling with rampant hallway medicine when this government came into power, and they managed to make things even worse. Burned-out nurses, healthcare workers have been leaving the sector in droves, right? They can't get out of here fast enough with this government in power. And guess what, Speaker? Private nursing agencies, the friends of this government, they've been ready to jump in and fill the gap, bleeding our hospitals dry at the same time, and demanding exorbitant fees for exactly the same work. So, Speaker, back to the Premier. Will he admit his choices worsened the crisis facing our healthcare system, and once and for all, please apologize to Ontarians for Bill 124?
Members will please take their seats. And the Premier.
I find this so ironic. Their government, the NDP government, supported the Liberals. They fired 1,600 nurses. We've registered 17,500, 80,000 since we've been in office. We're building 50 new hospitals, I said, and either building them or expanding the hospitals, adding 3,000 beds. We're going to add another 3,500 beds when these new hospitals go up. But one of the best was a couple of weeks ago when my Minister of Health added $110 million to connect 300,000 more patients to family physicians. And by the way, it's the lowest in the country, Mr. Speaker. We're going to continue investing into health care. Just the pharmacies alone served over 700,000 people that didn't have to go to the primary care docs in less than a year. That's what we're doing for health care. As they continue to vote against health care, we continue to fund it and expand health care.
Thank you. The next question, once again, the Leader of the Opposition.
Speaker, just consider for a moment, Speaker, how many times this government has let Ontarians down. Yep. And we are starting this session with another example of that, another policy reversal. Here's the thing, though. There are consequences. Because of Bill 124, the privatization of health care and the growth of these for-profit nursing agencies has absolutely exploded. Speaker, Ontarians want reliable, publicly delivered health care, not a publicly funded revenue stream for private companies. So, Speaker, back to the Premier. If the government is going to continue backing up the policy train this session, can they make reversing their privatization of health care their next signature policy reversal?
Members will please take their seats. The Deputy Premier and Minister of Health.
Speaker, I want to be very clear what the Leader of the Opposition is asking for. She is asking that 17,000 people who received cataract eye surgery and minor eye surgery last year are still on wait lists. That is what you are asking for. When Premier Ford announced an expansion of cataract surgeries in the province of Ontario in January of 2023, that meant 17,000 people are back reading to their children, are back volunteering in community, are back driving their vehicles. That's what we are doing to make sure people are looked after in the province of Ontario.
Supplementary question.
No, Speaker. What I'm asking for is for this government to stop wasting billions of dollars lining the pockets of private healthcare shareholders. While our operating rooms and our emergency rooms remain empty. Speaker, the government has had to backtrack on almost all of their major policy decisions because they met with tremendous public opposition. The Greenbelt grab.
All right, listening to question period in the Ontario legislature. MPPs back to work after a lengthy break. Marit Stiles wasting no time attacking Doug Ford, asking him to apologize to public sector workers in this province for the now repealed, controversial Bill 124, saying it always was and will be unconstitutional. For his part, Doug Ford not apologizing, but defending his record on health care, saying, I think the world of the nurses.